Welcome, business leaders, to our final installment of our regular series for the Workforce Resilience Through Mental Fitness monthly webinar series. This is produced by Utah Community Builders, the Salt Lake Chamber's Social Impact Foundation. These webinars are designed to provide you with actionable information from experts, innovators, and advocates to help enhance the mental fitness of your employees and make all of Utah's workforce the most resilient in the nation. Before we get into today's topic, I want to give a real quick shout out to our sponsors, those who have generously donated to help support this important webinar series and the other mental health efforts from Utah Community Builders. Our major leadership sponsor is the George S. and Dolores Dore Eccles Foundation. Champion sponsor, AT&T. Advocate sponsors, Larry H. Miller Group of Companies, FJ Management, and the Boyer Company. And ally sponsors, Blomquist Hale, Intermountain Health, and the Utah Department of Human Services. My hope is that any of you watching today, whether you're the president or CEO of a company, or if you work in HR or management, or whatever role you play in your organization, that you'll take what you hear today and evaluate your own businesses to consider how you can make a difference. With that, I'd like to introduce today's speaker, Dr. Matt Thiese. Dr. Thiese is an assistant professor at the University of Utah's Rocky Mountain Center for Occupational and Environmental Health. He holds his PhD in epidemiology. He's worked with the Centers for Disease Control on multiple research projects, and his research can be found in well-respected, peer-reviewed medical journals. With that, I'll turn it over to Dr. Thiese.
Wonderful. Thank you very much. Let me pull up my slides here and we'll get started. So the title of this talk, first off, I want to say thank you very much, Nick, for that introduction, and thank you to the Salt Lake Chamber for highlighting and illuminating the need for mental fitness among the Utah workforce. And I also want to thank all of you, the participants here, for taking time out of your schedule to come learn a little bit about the opportunities and different things about mental fitness and ways that we can all pull together and continue to make Utah a leading force in economic and mental well-being. So the title of my talk today is Shining the Light on Our Biggest Crisis. You may think that right now we're in the middle of a pandemic. Well, hopefully near the end of a pandemic, that should be the biggest crisis. But when you look at the numbers and the statistics, and being an epidemiologist, I'm going to be sharing some numbers and statistics with you. The challenges of just depression alone, let alone the full umbrella of mental health and mental fitness concerns, but just looking at depression alone versus what we've had going on with the COVID pandemic, depression still outstrips what we've had in terms of COVID here in the state. So it's an estimated 515,000 people in Utah are suffering from depression in one form or another. And we'll talk about that in terms of the spectrum. Compare that to around 390,000 infections that we have. That is stable, and unfortunately, depression and other mental challenges are getting worse. So let's talk about what we're going to go over today. I'm going to illuminate a couple of things. First off, we're going to talk a little bit about treatments. What are the most effective treatments for depression, and what can you be doing both as an individual and for your company to make some differences there? Why it makes sense for your organization to care. Why, obviously, you hear your antenna are up and you want to engage here. So helping give you some tools to help make those arguments as to what you can be doing with your company, and then what you can do today. A lot of the things that are generally talked about in mental health and mental fitness are some long-term goals. And obviously that's important, but really being able to do stuff in the short term is helpful. So we're going to get into a lot of that, what you can do today. So first off, let me give a little bit more of an introduction. As Nick said, I have my PhD in epidemiology. I have my master's in public health. I've been doing this for 20 years. So I've been looking at this overlap, the interplay between your job and your health. I'm technically an occupational epidemiologist. There aren't too many of us in the United States. And so my primary focus is how can we help make workers healthier and safer, and therefore make businesses healthier and more profitable. So currently I'm doing a lot of different projects working with the CDC. A big chunk of my time is looking at COVID research and vaccine efficacy, but also a lot of the challenges that have come from the pandemic and sort of the long-term ramifications of those and what we can do. And then I've also done a lot of research, for example, in the legal field, but in several other areas as well: transportation, manufacturing, construction, public service, hospitality. And in a lot of those areas, I've really had an increasing interest in this relationship between mental health and then an individual's physical health. And I was surprised actually at how strong and how robust that relationship is. So we'll get into that a little bit. But I've worked with companies, large companies, including Union Pacific and the LDS Church, to small, 6-person employee companies to help identify challenges that they have in their safety and health areas, specifically much of that around mental health. So let's talk a little bit about depression, and so we could sort of put some guardrails on what depression is. So depression really is a spectrum. There's mild depression all the way up to severe depression. Things like suicidal ideation, suicidal attempts is at that severe end, versus the mild. A lot of people have mild depression at one point or another. Worldwide, 264 million people suffer from depression. It is the leading cause of disability worldwide. And the statistics out there are more women are affected by depression than men. But it is an illness that can be successfully treated and across this entire spectrum. So a lot of the statistics I'm going to be bringing up are going to be using different definitions of depression, right? So there's symptoms of depression, there's duration plays a role, and then there's clinical depression. So I'll point out those differences there and the implications for them. But first, I actually wanted to ask all the participants here a question. What are the most effective treatments for depression? So we have talk therapy, which is traditionally what you think of when you think of treatment for depression, going and seeing a licensed clinician and talking through your challenges of depression. Is improved sleep, getting 8 hours of good quality sleep important. Are antidepressants the most effective treatments? Is it exercise, physical activity? Is it good nutrition, or is it cognitive behavioral therapy? So I actually want to have a little poll conducted here. If all of you if you can, choose what you think the most effective treatments are, and we will go through there and then talk about this a little bit afterwards. I'm curious to see what most people say. Pause for a quick drink of water. And of course, there are different, there are some right or wrong. I was going to say there are no right or wrong answers on this, but there really are some right or wrong answers. So we'll get into some of these specifics here after the poll and after we can see what the results are. We'll take just another few seconds or so. All right. Now, do I need to stop sharing in order to see the results?
You might.
Let's give it a try. Ah, there we are. Okay, so the winner by maybe a little bit more than a nose is exercise. So, but there were answers all over the place. So talk therapy, improved sleep, antidepressants, nutrition, cognitive behavioral therapy. So wonderful. I am actually pleasantly surprised that so many chose exercise. That is one of the ones that is a very effective treatment for depression. So we will jump back in here and share the screen, and we'll talk about these for a second. So the top two actually are exercise and cognitive behavioral therapy. Exercise, like most of you, well, the largest proportion of you, 32% said, is a great form of treatment for depression. It can help across the entire spectrum. And really the evidence-based medicine out there recommendations are getting enough exercise at a high enough intensity. So intensity-wise, meaning that when you're out exercising, you have a hard time carrying on a conversation. You can still talk. You're not breathing so heavily that you can't talk, but you want to be in that moderate to vigorous range. And you want to do that ideally most days a week for at least 20 minutes in a single bout during that time to have a positive effect on depression. It also helps with anxiety as well as other things like, obesity and diabetes. So exercise is a great tool. Cognitive behavioral therapy is another one, and it's a mouthful. Oftentimes it's abbreviated to CBT. And the first time I heard cognitive behavioral therapy, I thought it was a very robust, clinical treatment. And there's a lot of evidence behind it, but you don't have to actually go see a clinician to engage in cognitive behavioral therapy. There's individually guided cognitive behavioral therapy techniques, many of which can be done using, online or just your processes. So the theory behind cognitive behavioral therapy is that your thought processes dictate your mood, not the other way around. Oftentimes you may think, I do this often on, a weekend, I'm tired, I just want to relax, I don't really want to do anything, sort of maybe borderline depression, depressive symptoms there, right? And so I think I want to wait until I'm in a better mood before I get up and do something, right? I know I have to clean the house or do some work or whatever it is, and that's bringing me down. So I tend to, before I learned about cognitive behavioral therapy, I thought I need to wait until I'm in a better mood. But cognitive behavioral therapy actually says that by changing your thought process and getting up and doing things, that will have a positive impact on your mood. So let's go over a brief example on this. So if you're out, you see a snake in nature, you're going on a hike and you see a snake, different people have different reactions, right? So some people may recoil in fear or disgust. Some people may be really curious and intrigued by looking at that snake. Depending on how your reaction is, your thought processes, right? If you're scared, if you're disgusted by the snake, that really dictates your mood and how you behave in that particular situation. Cognitive behavioral therapy applies that throughout your life. So it actually is training and thinking about problems and addressing things in different ways. And so one of the, an example is that I learned actually from a colleague of mine is that whenever they're going and doing a presentation, right, they know that there's going to be something that's going to go wrong. And instead of dwelling on that problem of saying there's going to be something that causes a problem, they say, there's going to be things that go wrong and I'm just going to roll with it and move on and do the best that I can. And that change in that intellectual focus actually has a really positive effect on depressive symptoms and anxiety around giving a presentation, for example. So physical activity and cognitive behavioral therapy are two great treatments for depression. Let's talk a little bit about numbers in terms of depression, where some of these are going to be pre-COVID data, and just because we don't have a lot of current data based on everything. So US adult population, about 9.5% are clinically diagnosed with depression. So that is, people are depressed, they go in, they see a healthcare provider, they meet that threshold of diagnostic criteria, and they're diagnosed with depression. So 10% in the United States being diagnosed with depression. Unfortunately, that's really just the tip of the iceberg. So oftentimes for the traditional medical model is that people have to have trips sort of a threshold where they say, I'm depressed enough, or are encouraged to go see a healthcare provider about that. But really a huge percentage of people, some statistics say at 60%, experience symptoms of depression, right? So this is that underlying iceberg. And 80% of us will experience some form of depression some point within our lifetime. So while the 9.5 or 10% clinically diagnosed depression may seem relatively small, there's this really large proportion of individuals who are experiencing symptoms that can have an impact. So, and it's not uniform across all industries and across the workforce. So pre-COVID depression rates by industry, transportation generally has recorded as the highest levels of depression at 16.2%, followed by social workers and administration. So even subsectors within our workforce have meaningfully higher amounts of depression. So let's say in any given group, 15% of people are depressed. So out of 100, that's if you employ 100 people, it's fair to assume that 15% of them, 15 of those 100 are depressed. And 80% of those people who are depressed say that their depression has had some impact on their life, whether that's their life at home in terms of performing regular duties at home or on work, and productivity, showing up to work, or in relationships, whether that's at work or at home. And of those 15%, right? So of 15 people out of 100, 27% report serious difficulties at work and at home. So depression has a meaningful impact on how people can operate. And again, depression isn't a constant thing, right? It's not like traditional medical model of illness, where once you have diabetes, for example, you always are going to have diabetes, right? Or some other disease. Depression can really ebb and flow even within the day. Depressive symptoms can. And so being aware of that is something that will benefit your workers. So let's talk Utah specific versus the United States. So in Utah, a significantly higher proportion of individuals, and again, this was pre-pandemic, said that they had depression, right? So said that they were diagnosed with depression versus actually reported having clinical depression. So 18% have depression in the United States. Utah is about 50% higher there, well, 33% higher, saying that they have depression. So Utah already is starting off in a rough spot. And then trend over the past 7 years, we've had this upward trend. It hasn't been super steep. However, most recent reports have found that the COVID impact has had a meaningful spike in depressive symptoms and diagnoses of depression here in Utah. There was also just a report that came out earlier this week saying that concerns with drug overdoses and deaths from drug overdoses have also spiked during the COVID pandemic. So there's a lot of unfortunately, the COVID pandemic has really highlighted and exacerbated some of these mental health and mental fitness challenges that we're experiencing. Unfortunately, also, the supply cannot meet the demand. About 12% of the people surveyed in a large national survey reported that they cannot find treatment. So these are people who have depression to the level where they are looking for some type of treatment, and they were unable, a meaningful chunk of them were unable to find any treatment, right? So that again highlights this, this initiative by the chamber to help provide resources, and others, to help provide resources to the workers of Utah to help address some of these challenges. And also the amounts of depression are highest among people who are young, right? So 18 to 29 or 30 to 39. Those are a prime working age individuals where they're being most productive, versus, just as contrast, COVID has had a meaningful impact on the elderly, but has had less so of an impact on younger individuals. So again, highlighting the challenges of depression on Utah's workforce. So that's it in terms of statistics for there. Let's talk about how depression can impact your organization. So looking at big high-level statistics, There were 200 million lost workdays. It's estimated before the pandemic that there were 200 million lost workdays per year in the United States due to depression, and that there was a median per year cost of $30.5 billion related to depression. So these obviously are issues like direct treatment for depression and people going on disability for depression, but then also there's additional concerns and costs with injuries, for example. So depression is meaningfully related to having musculoskeletal injuries or having other workplace accidents and injuries. So for example, related to low back pain, if you're depressed, you're about 3.5 times more likely to develop low back pain as compared if you don't have depressive symptoms. There's also impacts on absenteeism, right? So people not showing up to work, those are lost work days sporadically. Productivity issues, and then also presenteeism. So that's where people are showing up to work, and so they're present, but they have decreased productivity. They're not as engaged in their occupation as they should be or were before the depression issues. So these are all issues that impact your organization and ways that you can improve based on what you're doing. There also is an association with social connection, and I wanted to bring this up because social support is meaningful both inside the workplace and outside of the workplace. So there's a lack of, if you have a lack of strong relationships, research has shown that increases your risk of premature death by 50%. So that increase of premature death by 50% is equivalent to smoking 15 cigarettes a day. And it's worse than if you're obese or if you're not performing physical activity. So having this social connection actually plays a big role in that. So that's where we are. That's where we stand in terms of what we know or what we think we know as of right now related to depression, both here in Utah and nationally, as well as the impacts on your organization. So let's shift here and talk about what can you do within your organization, right? What are things that you can do, whether you're in management, whether you're in HR or a safety professional, or even just, you know, a standard worker, right? A production associate, they're doing your job. Let's talk about what you can do. First off is to know where you are right now. Where is your organization right now? Go and take some measurements. Traditionally, people think of, you know, we need to go do a survey, and that's a great option. But you may also already have some metrics in place, things that you're tracking to give you an indication as to where you are, right? So those could be absence, days absent for your workers. They could be measures of productivity and output. You know, all of those, some of those metrics are important. They could be healthcare utilization, right? Those are often already tracked. But going out and doing some survey, there's several brief surveys out there. One is a PHQ-9, one that I would recommend. It stands for Patient Health Questionnaire. It's a 9-question, well-validated assessment looking specifically at depression, where you can identify individuals who are depressed, right? Who have different feelings of depression. I'm going to get into this in a little bit more. So know where you are right now, take some measurements, get a baseline standard for where your organization is. Second is lead in a vulnerable way. So this is modeling the behavior, being a leader, but not being afraid to show some vulnerability. There's actually a meaningful amount of research out there demonstrating that when you're vulnerable, when you express vulnerability, you actually are demonstrating confidence and courage and encouraging others that are around you that you're expressing that vulnerability to actually engage more than if you were stoic, as an example, right? So we'll get into that in a little bit more. Next is design and implement a plan. There's lots of different types of plans out there. Some of them are very easy, relatively easy to do. Some of them are more intense. Figuring out sort of what your appetite is for your organization's appetite is for that type of plan and change, and where you want to go, right? And then remeasure those impacts. Remeasure what you measure at the baseline so you can actually quantify and put some type of metric around the impact that you had. So first off, let's talk about assessing your employees. So these are the traditional sort of how are you types of questions, right? So scientific questionnaires are best. Ideally combining those with other data and other metrics that you already have, that you're collecting as part of your company is a great thing to do. There's a lot out there. I can provide some recommendations of different ones, depending on sort of what concerns that you have. They can be really short and very brief. Second is make sure that it's completely anonymous, and that your employees' information are protected. So you want to ensure that your employees are that your coworkers are going to be honest, right? If you don't have honest data, then it's that much more difficult to making decisions. So having some way to ensure that your employees recognize that the information they're giving is going to be protected and it's not going to be used against them. And a great opportunity is actually to use a third party to administer some of these. So you can bring in a separate group or individual to say, we're going to have this organization do an assessment. They can collect those data and then provide summary statistics about depression, and if there's even pockets of organizations. So if maybe one sort of productivity sector, one line, one location, right? If your company has different locations, if there's subgroups within your larger company that have different levels of depression or depressive symptoms, you can identify those and maybe target interventions more to those. However, it is also important to provide resources to all your employees because there is traditionally so much of a stigma around depression and mental fitness. There may be individuals who are feeling depression, have depression, and are afraid to tell you, right? So being able to provide resources to all employees is an important thing. Next is that leading by example and not being afraid to be vulnerable. So connect personally with your workforce is a very good way to help ensure that the data that you're collecting and moving on is true, but it also helps provide that moral support, right, for everyone else in your company. I'll tell a brief story. I was at a seminar. I was going to be speaking at a seminar. It was an industry seminar, and one of the presenters right before me stood up, and he's a leader in the field, and he told a story about how he goes to talk therapy once a week and how much that has helped him overcome challenges in his life, and it was a very meaningful personal story to an audience of 250 of his colleagues from other companies. It was industry-wide, to talk about the importance of being healthy at work. And so he was not afraid to be vulnerable, and the entire focus of the audience changed. And just by demonstrating that and standing up and telling his personal story of a little bit of challenge and how he's working on overcoming that, really engaged everyone in the audience, and they were that much more interested in participating and moving forward. That type of vulnerability, research has shown, has a meaningful impact when you're trying to make personal connections with people around you, whether that's one-on-one connections or larger groups. So don't be afraid to be vulnerable. Try sharing a personal story if you're comfortable. Obviously, if that's not your MO, your modus operandi, then don't do that, right? It's more important to be genuine than to follow these strict rules, right? Next is reduce fear of retribution. So you want to ensure that by telling a story, making personal connections is a way to reduce those concerns of employees that there's going to be some impact if they share their concerns about depression or their challenges or anything like that. And then also maybe consider creating some peer support groups. These can be one-on-one peer support groups. They can be focused specifically around depression or anxiety, or they can just be, connection peer support groups. An example is Trader Joe's. So they rotate their coworkers around every 90 minutes. And oftentimes they will schedule in a 15-minute break where people can get together and swap recipes. So having that type of personal connection, again, goes back to reduces depression, reduces premature death, and actually also helps individuals feel connected with their coworkers and their company. And so it can also reduce turnover and increase productivity. So those support peer groups, they can be a focus thing. They can be organically driven from within, from your workforce. And you may be surprised at what people end up doing, right? They may form a travel group and talk about, trips that they've been on, or even go on trips together. They may form a knitting group, book clubs, that type of stuff. You can also put some guardrails around those. And so you can direct and say, all right, if you're interested, we're going to talk about, have, a discussion about small group discussion where get together and do something like share your high and low of the day or high and low of the week, right? Share a personal story, share a challenge, share something, right? And there's lists of these that we can be found on the internet, or I'd be happy to share some of different sort of tools that you can go through and say, get into small groups and work on forming these personal connections is the ultimate goal. Next is to design and implement a plan, right? So that plan can be focused on a bunch of different things. But again, based on the research out there, there's a couple of things that are relatively easy to do that can have a big impact right off. So first is build in exercise, build in some type of physical activity, whether that's encouraging walking meetings. If you're in a traditional, office space setting, having breaks from sitting where they get up and you encourage people to get up and walk around. The research has demonstrated that engaging in physical activity, even just mild, low impact physical activity where you're able to easily carry on a conversation, but getting out in nature in particular, or getting with others, but doing some level of physical activity, even for a brief amount of time in the neighborhood of 10 or 15 minutes, increases productivity for about 90 minutes or longer after that physical activity bout has ended. So getting people up and exercising, it may seem like that takes away from the goal of the company of producing or engaging whatever they're doing. However, there's a fair amount of research out there that has demonstrated that it actually improves performance and improves output after that physical activity. So figuring out ways to design and implement those plans to get exercise is great. Another is encourage connections. So these meaningful one-on-one connections, having the mini fun gatherings, whether it's a recipe swap, or you can combine these where you can have step challenges or other physical activity challenges by group and encourage people to participate in that way. But if you can get those meaningful connections, that will also improve these relationships and have a meaningful impact in reducing depression. Excuse me. Also providing resources, whether that's peer-to-peer support trainings, having community resources. At the chamber, there's lots of resources available. The Safe UT app, where you can go and connect with counselors, having people come in and talk about different ways that you could improve depression, talking about cognitive behavioral therapy or the benefits of exercise, having those resources available to anyone who wants them, and making sure that they're well communicated to everyone should also be part of your plan. So once you create a plan, ideally, again, based on some data, some baseline information that you have, then go through afterwards and remeasure your success. Identify what went well. Look at the difference from before and after your intervention to say, okay, we reduced depressive symptoms, or we improved productivity, we reduced numbers of sick days. Whatever metrics you're looking at are a great way to help identify how well or how you can also improve on those interventions, right? So remeasuring injuries and sick days, asking those same questions that you had at baseline, and they don't have to take a long time. And then ideally you go back and use that as your new baseline data and make some minor tweaks, make some minor improvements, right? So you may also want to do an assessment and say, okay, of the different things that we tried, what worked well, right? Maybe it's people really like getting out and walking. So next step would be to create several different routes around the area you work in, the parking lot, that are safe routes that are marked out with distances to encourage people to get out and be physically active, right? And then using that, implementing it, and then going back and again, reassessing, remeasuring. So this doesn't have to be a one-time thing in terms of measure, implement something, and then reassess, but that can be a cyclical rotation where you can continuously work on improving. So that's it in terms of an organizational standpoint. I now want to talk about what can you do as an individual, right? So one of the big things is to really figure out where you are at where you are in terms of a depressive spectrum, right? A friend of mine, they went through and they took the patient health questionnaire 9 and the brief one, which has a 90% accuracy for identifying people who would be clinically, if they went into a clinical setting and saw a healthcare provider, they would be diagnosed as being depressed or not, right? So 90% accuracy on the PHQ-9. That's a really good tool. Anyway, my friend went through and did it, and it showed up that she would have moderate depression. And so I said, we had a conversation about it. She said, no, I'm not depressed. I'm type A and I'm a little anxious. And so I think it was a little bit of an eye-opening experience for me, and I think maybe for her as well, that there's a need to be honest when you're assessing your own feelings, particularly around depression, right? Also paying attention to duration, that time that you're feeling down or blue or depressed is also a big symptom, right? So again, it can ebb and flow over time. And so if you are concerned about that, maybe keeping a journal or doing, assessments at different times would be really helpful, right? So being for you as an individual, and this goes for your colleagues too, right? So if you have colleagues, coworkers that you are concerned about, encourage them to do a self-assessment, whether it's the PHQ-9 or others. And I'll talk about it a little bit. We have a tool available to anyone who wants to take it. It is the PHQ-9, that they can take it online. It's completely confidential, but it will give anyone who takes it, identify where they are in those feelings of depression on that depression spectrum. Also provide some opportunities, things that they can do immediately to feel better. So encourage other people, if you have concern, to go out and be honest and do a self-assessment. And then for individuals, don't wait for your mood to dictate your behavior, right? Have your behavior change, and that will change your mood. It's that whole thing. Physical activity is a great example, right? So getting up off the couch and going on a walk, going on a run, being engaged in some form of physical activity has been demonstrated to improve your mood, consistently, meaningfully improve your mood. So don't wait for your mood to dictate your behavior. Flip that on its head, change what you're doing, and your mood will improve. Next is schedule time with others, right? Work on making those and strengthening and improving and maintaining those meaningful connections with others. And then next is to simply commit to moving daily. Being up and being physically active is a great way to improve your mood and fight off some of those feelings of depression. There's also one thing that I failed to mention that I do want to bring up, and that is it's not, even if you're not feeling depressed. So say you go through and you take that individualized assessment and it comes back that you have no depressive symptoms. That doesn't mean that you should ignore these things that will help you feel better, right? Because we're not going just from a -10 to 0. Ideally, we want to get from a -10 all the way up to a +10, right? So it's not just an absence of depression, but you really actually doing these things, even if you're not feeling depressed, can improve your mood, can improve your engagement, and can improve your outlook on life. So doing these things, while they hopefully seem relatively easy, they can have a meaningful impact, and they can have a meaningful impact for everyone on that spectrum, not just people who are feeling depression. So here is the website, thelightbulbcure.com/mental-health. This is a completely free and anonymous tool that we created. It utilizes the Patient Health Questionnaire 9, that 9-question assessment. You can go to it. Anyone can go to it. So you can encourage your colleagues, your friends, your family to go to it. Take an assessment, figure out where you are on that spectrum. And then there's also some recommendations there if you're interested in ways that you could work on improving that mental health, the mental fitness. The recommendations here are also, they're based on evidence-based research, and they're also relatively easy to do. So they're not massive life-changing things that are long-term. They are things you can do right now to have a big impact on your mood right now, and then hopefully be able to perpetuate that going forward and continue to improve your mood. So that's pretty much the end of this discussion. Of this presentation. I'm looking forward to engaging in the discussion. Again, thank you for taking the time to help me shine the light on our biggest crisis right now, which is mental health and depression, and to share some of these things. So again, most effective treatments for depression that are easy to do are exercise and cognitive behavioral therapy, changing your thought process. Why it makes sense for your organization to care is that really happy and healthy employees equals a better organization, a healthier from a financial standpoint for your organization, but also from your morale, turnover, productivity. And then what can be done today? Go to thelightbulbcure.com/mental health and take that assessment, and encourage others to take that assessment. Here's my contact information. Again, please call me Matt. Unless I'm in trouble, then you can call me Matthew. My email here is matt.thiese@SafelineHealth. This is my cell phone number. I would be happy to talk with anyone at any time about an assessment piece. If you want to design an intervention or get some feedback, if you want me to come in and help in any way. This is what I do, right? As an occupational epidemiologist, my goal is to help improve the health and safety of workers, and therefore help improve the company. And that is our goal at Safeline Health as well, is to have a meaningful impact on improving the health and safety of workers. So I believe that's it. I'm going to stop sharing, I think, Nick, and we have a little bit of time for questions.
Yes, thank you, Matt. That was phenomenal. I mean, just some of the data points in that presentation, I think, are deeply relevant to the community, to our businesses. So thank you for all of us here at the Chamber and at Utah Community Builders for spending some time with us today. Want to keep you for a few more minutes to go through some questions. We've got a couple questions in the chat that I want to get to, but first I want to emphasize one thing you said kind of toward the tail end of your presentation, that in a nutshell, this isn't just about folks who have a clinical diagnosis of depression. That I think one of your early stats that said 80% of us will experience some form of depression-like symptoms at some point in our lifetime. And so I wanted to kind of kick off the discussion portion, if you can expound on a little bit. Again, one of the themes of this Workforce Resilience Through Mental Fitness initiative is that this applies to all of us, whether we have a clinical diagnosis or not. And it's about thriving. I love what you said, that it's not just about not having depression, but it's about getting to that positive 10. So can you talk a little bit about, for business leaders who are watching, how can they make sure that the approach that they're able to employ is not just looking at, again, the clinical diagnosis, but the broader idea of what interventions can I put in place in my business to help my employees to not only not have depressive symptoms, but also to thrive?
Absolutely. So, and I think that's a great point. And I apologize that I didn't bring it up earlier, but yeah, being able to identify, it's not just the negative side of things, but really going towards as far as we can on the positive side and the engagement. One of the great things actually is that the same tools to get you from a -10 to a 0 are the same things that can go from a -0 up to a +10, from a 0 up to a +10. So again, physical activity, cognitive behavioral therapy, it's a little more, it's a little more challenging to create a cognitive behavioral therapy sort of program than it is a physical activity program, right? But really, to create a cognitive behavioral therapy program for individuals in your workforce, it's a relatively simple lift. And it really is helping people identify those negative thought processes that create these downward spirals and saying, all right, how can we address those and how can we change them? So those, and then the personal connections. So really those three are the ones that are relatively easy to do, that anyone can do to help move from a 0 where, I'm feeling fine, I don't have any problems. Can I be better, right? Luckily, evidence has demonstrated it's those same tools. Does that help answer that question?
Yes, I think that's perfect. Thank you. So in that context, as we look at what businesses can do, a couple of the questions here in our chat. One viewer asked, how can we easily identify if someone has depression, and what's the best way to help that person? I get that this is kind of the entirety of your presentation, but specifically, if a manager or a leader in a business, what are some things that they can look out for to be able to understand and gauge how my employees are doing? And then I'll add a caveat onto the question of, in a way that is not singling the person out or making them feel bad because of this experience.
Absolutely. So there's sort of two thoughts there. First is, how can you help identify individuals? Things like being late to work, not showing up to work, not being really engaged with coworkers or those around them. If you're trying to create a one-on-one, personal connection, and that doesn't work very well, those are all potential symptoms. However, it can also be really hard to spot, right? I mean, thinking back to Robin Williams as an example, right? He seemed like he was doing great. He seemed like he was a funny person. He was engaged, he was successful, and yet he was battling with depression. So it's really hard to identify people on a one-on-one type of basis from an exterior point of view, which is why having some type of self-assessment and encouraging people to be honest is a good, you want to do some of both, right? You don't want to just have a self-assessment and rely on that and say, oh, there we go. You want to work on trying to identify based on behaviors, again, if they're late to work, if they're not showing up for work, not engaging with others, those can all be signs, but others can have depression too and not exhibit any of those. So sort of having a multi-pronged approach. And then the second part of how do you sort of approach someone and say, look, I'm concerned about you. That can also be done in a multi-pronged approach, and it should be authentic. Whatever you're comfortable with as a manager or leader, it should be authentic. So if you have a seminar and you share a personal experience and you demonstrate some of that vulnerability, that can be a good way to encourage people to feel comfortable. And then if you have an opportunity to say, I'd be happy to talk with anyone, or here's some resources, or here's a self-assessment piece, right? But then also talking with that in person on a one-on-one basis and say, this is something that I'm concerned about with you. This is ways that I this is what I'm noticing, right? Being very professional, obviously, not making accusations. Yes, so being able to identify and talk with people in an authentic way would be my two recommendations. And also just, the third way of saying, here's a self-assessment and here are ways that you can engage individually, and just really providing as much resources and as much support for individuals to be able to make that step themselves would be a third option.
Thank you. And another comment that's come in kind of related to that is one viewer saying managers need to be empathetic and want to engage rather than just, go through some kind of formal process, but that expressing that empathy, that engagement, and building the relationship with employees in ways that are appropriate to be able to have these kinds of conversations as you've outlined. Another question from one of our viewers, could you share a few ideas on how to support those that are in the throes of depression at work? And they mentioned intermittent or continuous FMLA employees. And I imagine that could be someone who is experiencing more severe depression, that if that does affect their work in more substantial ways like that, where they take more time off and those kinds of things. What can an employer do to be helpful in that situation?
Absolutely. So again, this is an entire spectrum. So if people have severe depression where they're considering self-harm, intervening is important, right? Saying, I'm concerned about you, I care about you, please call the suicide helpline, or here's some local resources, right? There's a whole meaningful amount of resources for that far end of the spectrum, right? Because that's where if you don't do something, people can die. People can take their own lives. We can lose people to this disease. It's really that next sort of moderately severe depression where they're not on that precipice that can be really challenging to get people to address those challenges, right? So the question about intermittent FMLA, not showing up to work consistently. So if you have individual connections where you can talk with people, and again, modeling that behavior, saying, I've had challenges with depression, or my brother has, or whatever it is, being able to talk about that in a respectful and professional way is one. Providing resources, whether that's bringing in outside resources from an employee assistance program or other experts to meet, either to do sort of a broad brush approach where you personally invite that individual and say, look, this is important to me that you're there. And so it's not singling them out, but it's in a larger sense, but it's demonstrating that you care about them in that relationship. And then also trying to encourage them to participate to get some help, whether that's going to some of these other types of treatments that are more intensive, whether that's talk therapy or whether that's antidepressants. So evidence-based medicine is pretty good for antidepressants on having an impact on people at that level. It also, but there's meaningful side effects, and B, it takes time, right? We're talking multiple weeks for them to get into the healthcare system, get antidepressants, get on them, take them regularly, get them into the system, and have that make an impact. So having again, multi-pronged approach where you go out and specifically try to engage that person, provide resources, get them physically active, get them CBT, engage your EAP, and really start trying to move them from that sort of not paralyzed, but they're in a danger zone, right? And move them up to where they have a little bit more of some functionality. When they're on FMLA, often, there's some challenges there. So those would be my recommendations in this brief time, but I'd be happy to talk with individuals more too.
Well, we've got just a couple minutes left, so kind of to finish off the discussion portion, I want to go back to something that you alluded to toward the beginning of your presentation, specifically about the context of mental health in the overall relationship with the pandemic. And I think just this week, in the last couple of days, there were some new stats coming out that suggested that suicide rates had actually declined. I think that was nationwide, were actually lower in 2020 than some people feared. And I know that some people were saying, well, were the concerns about the mental health impact of the pandemic and all the associated effects, were those concerns overblown? So I guess kind of to pose that question to you with the second piece of help us understand how this issue, if we don't take the right interventions now, long term could become even more impactful in a negative way in our businesses, and why it's so important for businesses to be able to intervene now and make a positive difference. Absolutely.
So suicides are unfortunately relatively, I'm putting on my public health hat now, right? So suicides there's some challenge in identifying suicide. So I've seen some of those reports too, that if some suicide rate, it looks like suicide rates are lower than what was anticipated. But there was just, like I mentioned earlier, a report that came out that says drug overdoses are way up, right? So it's really challenging to look at, to identify that on a very specific level when we're in it. I think when we get through a little bit further out of the pandemic, we'll be able to look back at data and say, yes, there were meaningful increases in depression, and excess death, however you want to define that, whether that's drug overdoses or suicides or other challenges. But there's still a need there. Even without the pandemic, Utah in general was having that poor upward trend of increasing levels of depression. And the fact that depression impacts not just your life and your productivity, psychologically and your thought process, but it affects the lives of those around you, whether that's your family or your coworkers, as well as can have a meaningful and has demonstrated evidence with injuries and outcomes at the workplace. So trying to get a handle on where you are in the company, what can be done, and basing those interventions on evidence-based medicine. Not that there's anything wrong with meditation and those types of interventions. There's a place for those, but those haven't shown the same impacts in terms of positive results on depression that physical activity and cognitive behavioral therapy have. So, having evidence-based tools to move forward and reduce the amount of depression in your workforce will have long-term benefits by keeping workers at your company, having them be productive, and strengthening those relationships with their coworkers, even regardless of the pandemic. But I think the pandemic has exacerbated a lot of this, and the data will become more apparent. Unfortunately, we can only do that looking back.
Well, Dr. Thiese, that is our time for today. We want to again thank you for being with us today and walking through some of this information, as well as answering some questions from our viewers. I want to encourage everybody watching today that we're, of course, going to send out this material via email. We'll include the webinar. And Dr. Thiese, if you're okay with us including some contact information for you as well, encourage you all to get in touch with him. We also will point you to our Suicide Prevention in the Workforce Employer Toolkit and the other resources on the Workforce Resilience page on the Salt Lake Chamber website. So for that, for Utah Community Builders and the Salt Lake Chamber, thank you again, Dr. Thiese, and thank you everyone for joining us today.
Thank you very much.